Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Storm Robotics article. This audio podcast is part of a Raptor Storm. This audio podcast is part of a Platinum Edition, and this audio podcast as part of a Storm Robotics production. So now looking at the sort of clinical evaluations and findings in around Crouzons syndrome, some of the clinical evaluation and findings. So the best time to intervene in neonates and also sort of pediatrics and young people for surgical correction is when the infant is between the ages of 3 and 9 months. 3 and 9 months for craniosynostosis, but patients or recipients with signs of raised ICP or intracranial pressure, in around raised intracranial pressure in around and around Crouzons it has been evidenced of that decompression around the raised ICP may be required. Decompression may be required urgently. Detection of micro and macrocephaly is caused by hydrocephalus, and persistent or ridging at the suture lines, as at the sort of the in around the suture lines is in infants or in neonates or infants with abnormally shaped head, in an abnormally sort of shaped head or fontanelle, is suggestive of craniosynostosis. That draws this audio podcast to a close. This audio podcast as part of a Storm Robotics article. This audio podcast as part of a Raptor Storm. This audio podcast as part of a Platinum Edition. And this audio podcast as part of a Storm Robotics production.